Emphysema is a long-term lung condition. It affects the alveoli, which are the tiny air sacs in the lungs where oxygen and carbon dioxide are exchanged. These air sacs are normally elastic. They expand when you breathe in and contract when you breathe out, helping push stale air out of your lungs. But with emphysema, those air sacs lose their elasticity. They stretch out and become damaged, like a worn-out rubber band. Instead of bouncing back into shape, they stay stretched, trapping stale air inside. This means fresh oxygen can't get in and carbon dioxide can't get out as easily. Over time, breathing becomes harder and less efficient. The body starts to struggle. Even everyday activities like walking, climbing stairs, or getting dressed can leave someone breathless and exhausted. As the disease progresses, the lungs remain expanded with trapped air, and the chest may become barrel-shaped. This happens because the lungs are constantly overinflated but can't release enough air with each exhale. The damage is irreversible. But understanding how and why it happens is the first step to managing it. What causes emphysema? The number one cause of emphysema is smoking. Cigarette smoke is full of toxic chemicals that damage the delicate tissues in the lungs. In fact, smoking is responsible for about 80 to 90% of all cases of emphysema. But smoking isn't the only cause. Long-term exposure to air pollution, industrial fumes, dust, and toxic gases can also contribute, especially in people who work in high-risk environments like construction, mining, or manufacturing. Another important cause is a rare genetic condition known as alpha-1 antitrypsin deficiency. This condition makes people more vulnerable to lung damage, even if they've never smoked a day in their life. Other factors, like chronic bronchitis and repeated respiratory infections, can also increase the risk. No matter the cause, the end result is the same: damaged air sacs, trapped air, and a body struggling to breathe. Recognizing the symptoms. The symptoms of emphysema often come on slowly, so slowly, in fact, that many people don't realize there's a problem until significant lung damage has already occurred. At first, you might just feel winded more easily. You might avoid physical activity without realizing why, but over time the symptoms become more obvious and more difficult to ignore. Common symptoms include shortness of breath, especially during physical activity, a chronic cough that doesn't go away, wheezing or a whistling sound while breathing, fatigue and lack of energy, chest tightness or discomfort, unexplained weight loss, a barrel-shaped chest. Because emphysema develops gradually, many people mistake early signs for normal aging or being out of shape. But if you're experiencing any of these symptoms regularly, it's worth getting checked out. How emphysema is diagnosed. Diagnosing emphysema starts with a thorough medical history. Your doctor will ask questions about your smoking habits, your exposure to irritants, and any history of respiratory issues. Next comes a physical exam. Your doctor may listen to your lungs, check your oxygen levels, and look for signs like a barrel-shaped chest or labored breathing. The most important test for diagnosing emphysema is called spirometry. It's a simple lung function test where you breathe into a device that measures how much air you can inhale and exhale, and how quickly you can do it. This helps determine how well your lungs are working. Other diagnostic tools include chest X-rays or CT scans, which can show lung damage blood tests to measure oxygen and carbon dioxide levels, pulse oximetry, a painless test that estimates oxygen saturation in your blood. Together, these tests give a clear picture of how far the disease has progressed and what treatment is needed. Treating emphysema now for the big question, can emphysema be cured? Unfortunately, no. The damage to the lungs is permanent, but the good news is that treatment can slow the disease, relieve symptoms, and improve quality of life. Let's walk through the main treatment options. First, medications. These are often the first line of defense. Bronchodilators help relax and open up the airways, making it easier to breathe. These are usually inhaled and taken daily. Corticosteroids reduce inflammation in the lungs and may be taken as pills or inhalers. Antibiotics are used to treat and prevent lung infections, which can be dangerous for people with emphysema. Vaccinations are crucial. A yearly flu shot and pneumonia vaccines are highly recommended to prevent complications. For people with low blood oxygen levels, oxygen therapy may be needed. This involves using a portable oxygen device that delivers oxygen through a nasal tube or mask. Some people use it only at night or during activity, while others need it all the time. In more severe cases, surgical options may be considered. One procedure, called lung volume reduction surgery, removes the most damaged portions of the lung. This gives healthier areas more room to expand and function better, and in the most advanced cases, a lung transplant might be the only option. It's a major decision and not without risks, but for some, it offers a new lease on life. Complementary and alternative therapies. In addition to traditional medical treatments, many people explore complementary therapies to support their breathing and well-being. Aromatherapy is one such option. Essential oils like thyme, eucalyptus, and hyssop are believed to have properties that ease breathing. While there's limited scientific evidence, some people find relief by inhaling these oils through steam or diffusers. Herbal medicine is another approach. Elecampane root, for example, has been used to clear phlegm from the lungs. Traditional Chinese medicine often uses blends containing cinnamon, licorice root, and apricot seeds for lung health. Tai Chi, a gentle form of exercise, helps maintain mobility, balance, and lung function without overexerting the body. Similarly, yoga, especially breathing-focused practices, can improve relaxation and help people breathe more deeply and efficiently. While these therapies may not treat the root cause of emphysema, they can support overall well-being. Just be sure to consult your doctor before adding anything new to your routine. Self-care and lifestyle. If you have emphysema or want to reduce your risk, the most important thing you can do is quit smoking. Period. Even if you've smoked for decades, quitting now can prevent further damage and significantly slow the disease. Some early changes to your lungs may even reverse after you quit. Beyond quitting smoking, there are several other self-care strategies that make a big difference. Avoid secondhand smoke and pollutants. Stay away from smoky rooms, chemical fumes, and dusty environments. Exercise regularly, but carefully. Walking, light cycling, or stretching can strengthen your lungs and muscles, but always at your own pace. Eat a healthy diet. Nutrient-rich foods support your immune system and help you maintain a healthy weight. Practice pursed lip breathing. This technique involves inhaling through your nose and exhaling slowly through pursed lips. It helps release trapped air and makes breathing easier. Get enough rest. Plan your day around your energy levels. Take breaks, pace your activities, and listen to your body. Watch your weight. Extra weight can make breathing harder. On the other hand, unintentional weight loss can weaken your body. A balanced approach is key. Limit salt intake. This helps prevent fluid retention, especially if you have complications like swelling in your legs or a condition called cor pulmonale, which is a type of heart failure linked to severe lung disease. Managing emphysema is about maintaining the healthiest lifestyle possible. The better care you take of your body, the more you can reduce symptoms and improve your day-to-day life. Living with emphysema can be challenging, but with the right knowledge, the right support, and the right care, it's possible to live a full and meaningful life. There's no magic cure, but there is power in awareness, action, and a commitment to your health. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit. And remember, every breath matters. Thanks for watching.